Skin and eye infections. The skin is the largest organ of the human body, and it's basically designed to help with the immune system and to keep out infections through the various layers of the skin and the various defense mechanisms. For example, like perspiration will help to wash away any microbe due to the content of the actual salt content and the acidic pH that is within the sweat, so it helps with preventing any sort of infection from starting from different microorganisms. So the body contains a lot of normal flora that just resides on the surface layer of the skin, within the sweat glands, and various glands throughout the body, as well as the hair follicles. And so the skin kind of keeps this nice ecosystem where it helps to prevent various infections from forming. And within those normal flora that is on the skin, some of the things that we normally see as part of normal flora would be your Staphylococcus species, Pseudomonas, and of course you have a yeast that can reside on the skin, causing a type of fungal infection. And there are various lesions that can form due to different infections. Just because there is a lesion does not necessarily mean there isn't an infection, because there are other things that can cause various lesions. But this is some examples of some of the different lesions that can form throughout the body in the various skin layers. So just because you see a lesion on the skin doesn't necessarily mean that it is an infection, because there are other things that can cause lesions, like allergic type reactions to foods, medications. So just because you see a lesion does not mean that it is necessarily an infection. So what we're going to look at first is some of the different viral skin infections. So we have several of those listed here with the different types of rashes or skin lesions that it can cause, and so we're going to discuss those in a little bit more detail. So first we're going to talk about chickenpox and shingles. This is one that we've all pretty much have heard about. Most people either have had chickenpox as a child or they've received the vaccine. Depending on what age group you in will depend on whether you are young enough to actually receive the vaccine when the vaccines came out. Usually adults that contract chickenpox will be more severe than if you were to contract chickenpox as a child. And of course, symptoms would include fever and that characteristic rash. Shingles is a result of the reactivation of the varicella infection or virus that is in the body. So that reactivation is what actually causes shingles. And so shingles can have symptoms of headache, flu-like symptoms, and of course a very, very painful rash. And depending on where that the virons from that infection actually go, it can affect those nerve lines. So people can have them in various spots throughout the body, but they do travel along those nerves and causes severe pain. Smallpox is one that we've heard of actually here in the past few weeks, as there are some cases that are popping up, even though it had been eradicated by the 1980s. So vaccines aren't really used for smallpox anymore. So because it has been eradicated, this is something that is considered as a bioterrorism threat, since people aren't typically vaccinated now. The herpes simplex virus is the cause of various skin lesions. And so it can cause painful, itchy lesions on the lips, and it's transmitted through respiratory droplets and saliva. And so typically this is going to be diagnosed based on history and then some type of DNA testing or antibody type testing to actually look for this virus or exposure to this virus. And then we are looking at HPV as causes of warts. So these warts that affect the skin as well as the mucous membranes. And so it can be, this virus can enter due to an abrasion, some sort of direct or indirect contact through some sort of contaminated source. And so then it will form those actual warts within the skin and mucous membranes. You've got a variety of warts that can come up in a variety of places, like the feet or the genitalia area, or basically anywhere throughout the body. And so most of these do resolve on their own, but sometimes they do have to be removed through various procedures. And measles. Of course, measles now is mostly prevented by a vaccination. But signs and symptoms of measles include fever, sore throat, cough, and of course the characteristic rash that covers the body with red spots, white dots within the center of those rashes, in the mouth. And then once it starts in the mouth, then it can start to kind of spread throughout the face and on throughout the body. And then this is usually diagnosed based on this history, the patient's history or their presentation. Or you can also have various antibody testing that can be performed to diagnose this infection. And of course we have German measles, which again is part of that MMR vaccine. And so this one is spread through the respiratory tract and throughout the lymph nodes, and then it's carried throughout the body through the bloodstream. And with this one as well, there's a rash, and then you can also have fever, swollen lymph nodes that are really tender, muscle aches, joint aches, body aches, runny nose. And complications of having German measles could be within pregnant women to actually have miscarriages and stillbirths if they're infected, which can actually affect the infant. Fifth disease is caused by the parvovirus B19. And with this infection, it's more common in your child care settings or younger adolescent children. With this particular infection, it's usually peaked during the winter or early spring months, and it's spread through respiratory droplets. The bad thing about this particular infection is it's contagious before the rash actually appears. So usually once the rash appears and the parents are aware that something's going on with the child, by this point they've already exposed others, and so that's where you start having the outbreaks within daycares and through your elementary schools, preschool settings. Signs and symptoms include cold-like symptoms, and then a rash that will actually develop on the cheeks, and so they call this a slapped cheek disease, or slapped cheek infection. And that rash, once it appears on the face, it will actually start to spread throughout the body. Although you can have some asymptomatic cases, but it's usually mild. Occasionally you can see adults that are exposed that will have this as well. With roseola, this is from the herpes virus 6 and 7. And with this one, it again is a respiratory infection that's spread usually throughout children. And this one can be accompanied by a very high fever, runny nose, mild diarrhea, swollen lymph nodes, and then of course a rash that will develop on the trunk and arms, and it has like a lace looking pattern to it as well. And so this one, most of these rashes are going to be diagnosed based on the actual rash itself, and it's pretty much supportive therapy for all of these. hand, foot, and mouth disease, Coxsackie virus, A16, and enterovirus 71. This particular infection, again, is throughout schools and daycares, spreading through children, and it's a respiratory droplet type spread, although it can be fecal oral. Again, with this one, fever, malaise, and you do see the blisters that will form actually in the hand, the palms of the hands or the fingers, as well as the bottoms of the feet, and within the mouth. And so this can cause feeding difficulties for children and infants. And it doesn't happen very often, but you do occasionally see this infection within adults. Next, we're going to look at some of the different bacterial skin infections that you will see. Acne, of course, we're all pretty familiar with acne. It usually comes from normal skin flora that becomes opportunistic. It's more common in your teenagers, young adults, but you can see it throughout adulthood. And so what will happen is the pores or the hair follicles will actually become clogged and can actually cause that infection or that organism for P. acnes to actually start proliferating within that pore and causing an inflammatory response, and that's where you actually start seeing the signs of acne. So we've got several infections that can be a result of your gram-positive cocci, and some that we see more common are your Staph aureus infections. You can have impetigo, cellulitis, folliculitis, and so again, all of those will present with that inflammatory response of the skin layers, some sort of lesion, like a pus-filled type lesion or reddened hard skin. Some of them can start forming scab type lesions. Some of them can be filled with pus. And then some of them can actually kind of crust over, so it just depends on where the infection actually happens as to what you would see. And some of these infections too, they can start to penetrate to the deeper layers of skin and penetrate throughout the lymph nodes in the blood system and cause more fatal sepsis type infections. So being sure to treat infections and watch for different signs of leading towards some sort of septic type infection is very important. So watching for things like fever, chills, and stuff like that. So some of the things that we have to look for when we're dealing with a Staphylococcus aureus infection is if the particular species on that patient has developed any sort of antibiotic resistance. And so what the bacteria will actually do will start to produce various enzymes that will assemble within that peptidoglycan that's in that bacterial cell wall, and it just forms the ability to withstand any sort of penetration from that organism, from that antibiotic, which would typically enter into that cell wall and lyse it open and burst it. But then you had organisms that started developing that resistance against penicillin, for example. So they developed that penicillinase or beta-lactamase, which made them not be able to be penetrated by the actual penicillin. So methicillin was produced to kind of help combat those organisms that were able to defend themselves against penicillin. And so over time, with exposure to methicillin, then some of those organisms will start to change that structure in their cell wall and be resistant to methicillin. So organisms like that now have to be treated with other things. But we are starting to see some that are vancomycin resistant as well, so it makes it a little bit harder to treat or infections like this once they start developing, that particular organism starts developing a multi-drug resistance, then those infections become harder to treat. So prevention is really what we work towards to prevent those infections or those particular resistance of those particular infections. And so healthcare workers should follow hand washing protocols and antisepsis techniques and precautions when we're worried about the risk of organisms that can develop a resistance. Scalded skin syndrome is a result of a Staphylococcus infection of that the top layer of skin, in which those toxins will cause that skin to actually peel off, so it looks like the patient has been burned with like boiling water. And then as that skin layer peels off, then it does open up the opportunity of infection for the lower layers of that skin, because that you don't have that first layer of defense. This chart here just compares Staph aureus and Strep pyogenes and the different virulence factors that they have as far as being able to infect a patient and how they infect the patient, the different factors that they can use for infection. So Strep pyogenes, we typically think of to cause strep throat, but it can actually spread or come in contact of damaged skin, and it can cause other infections like necrotizing fasciitis as well as toxic shock syndrome. And so with this particular organism, because it can spread to so many places, it can be a normal flora, but then it can be opportunistic and cause other infections. With the necrotizing fasciitis, we typically refer to this like flesh-eating, a flesh-eating type infection, where it infects those various layers, different layers of the skin, and it can actually work its way through the soft tissue. And so making sure you treat a group A streptococcus or a strep pyogenes infection is very important, because you do want to prevent any sort of spreads throughout the body, or as well as you want to prevent it from producing those toxins, those various toxins that can cause the breakdown of the tissue, or to actually be able to start invading tissue. So now we're looking at infections that can happen within wounds or ear infections. And so we see this a lot with a Pseudomonas. And of course, Pseudomonas is that gram-negative organism that smells like grapes when it's grown on a plate, and it has that, it produces that pigment, and so you can sometimes see that pigment within the actual infection, especially if it's like under nail beds. Here you can see a picture of an infection on the bottom of a foot, and you can see that greenish cyan type color around that wound from where that organism produces that color. So anytime there's any sort of wound infection that you see that pigment of the skin, that green pigment, then you should be concerned that you're possibly dealing with a Pseudomonas type infection. Gangrene is caused by Clostridium perfringens, and so this is a gram-positive bacteria that we typically find like in the soil, water, intestinal tract of various animals, including humans. Diabetics are more prone to this just because there's reduced circulation throughout the body. Usually the lower limbs, the toes, the feet, lower legs are what are affected because the circulation is reduced to those areas, so there's not like good oxygen exchange, and it just creates a stagnant type environment in those lower limbs, of which allows the organisms to grow. Cutaneous anthrax, which is caused by Bacillus anthracis. So this is a gram-positive spore-forming bacteria that's found in soil, and of course it enters through the wound, through direct contact, and then it starts forming that nodule on the skin. If it's left untreated, it can be deadly, and so being aware of how the patient was infected is sometimes beneficial to try to help diagnose this particular infection. There are various fungal infections that we do see of the skin. They're usually superficial, meaning they're just at those top layers of skin, although you can have some that can go a little bit lower in the cutaneous, subcutaneous layers of the skin, so we're going to discuss those. First, we have Candidias, which is a Candida albicans infection. So this is one of the more common yeasts that we do see, and it usually will come about due to prior antibiotic use or moist conditions of the skins. You see this very often in diabetic and immunocompromised patients. And so what you usually will see will be an itchy type rash that can sometimes burn with these patients, and a lot of times it can be diagnosed just based on how the patient presents, but antifungal creams can be used if this infection is suspected. And occasionally you will have physicians that will do skin scrapings to look for the actual yeast cells under the microscope, so they'll look for that budding yeast appearance. You can also see this with a lot in infants with diaper rash, or you can even see it in the mouth. And then with women, you can see it under the breast. A lot of times it will grow under the breast because of that moist, warm environment. You can also see it in patients throughout the body, like under their arms and their groin area, due to that moist, warm environment. Tinea infections or ringworm. We can see athlete's foot, jock itch, tinea capitis of the scalp, the head, within the nails or throughout the body. And so a lot of people do get confused because when they hear ringworm, they think of an actual worm, but it's basically just that circular shape where fungus tend to grow from the center out. So even outside in the outdoor environment, if you see mushrooms growing, if you've got a big enough area, you can see that they kind of grow in a circular pattern. Funguses tend to grow from a center out, so that's where you get that circular pattern from. And so most of these are diagnosed based on appearance, but you can do cultures or skin scrapings to look for these various fungal elements. Leishmaniasis, this is a parasitic type infection, and you have a couple of different types of leishmaniasis infections. You can have cutaneous, mucocutaneous, and visceral type infections. So depending on how the organism enters, whether or not it's caught early enough, will depend on exactly which infection you have or how far it spreads throughout the body. With eye infections, they are typically caused by bacteria and viruses, but we can occasionally see fungal and parasitic infections. The eye does have a normal flora that helps with preventing infections, but most of the time when we see infections, it's due to some sort of traumatic exposure or through some sort of exposure like contaminated hands or contact lenses does increase the risk of infection. So making sure to properly clean lenses and make sure you use solutions that are free of any sort of contamination. Occasionally there are contact solutions that get recalled due to bacterial contamination. So things that we see for eye infections would be conjunctivitis or pink eye. Most everybody gets pink eye at some point in their life. And there are contagious and non-contagious forms of conjunctivitis. Of course, your contagious would be caused by some sort of microbe, whereas non-contagious would be some sort of like allergen or chemical type of reaction that causes the eye to look like a bacterial type infection. You also have trachoma, which will infect the inner surface of the eyelids and cause a very painful type roughening of that surface of that eyelid. Keratitis. This can infect the cornea, so that protective layer of the cornea is destroyed and it leaves it accessible to infection. And so this infection is a little bit more severe infection, so it does need immediate attention. So non-neonatal conjunctivitis, it can be viral or bacterial, and of course it is contagious. It's very common in contact lens wearers or school-age children, and so it's basically going to be transmitted from just exposure of the organism or the virus into the eye somehow, usually just your hands in your face getting close to your eye, or contaminated contact lenses or solution will cause a viral or bacterial conjunctivitis. Trachoma is caused by Chlamydia trachomitis. And so with this particular infection, we see it most often in areas that don't have clean water supplies or they don't have good sanitation type conditions. And so and people again will touch their eyes and then contaminate their eyes, and so the infection will start from there. So with this particular infection, it will produce that roughness to the eyelid, and so that can become very painful. It's typically going to be diagnosed based on symptoms and then treated with some sort of antibiotic eye drop. Viral keratitis can be caused by the herpes simplex virus. And so with this particular infection, instead of reactivation through the trigeminal nerve, which is the nerve that runs from behind the ear throughout the face, the 3 branches of the face, this will actually reinfect within the optical nerve path and will cause problems within the eye, like conjunctivitis, eye pain, blurred vision, sensitivity to light. And so this also can be very painful. We have bacterial keratitis, which can be caused by Pseudomonas or Staph aureus. And again, contact lens infections is usually what's going to be associated with this type of infection. Fungal keratitis can be caused by Fusarium, Aspergillus, or Candida. And so with these infections, it's usually due to some sort of eye trauma or weakened immune system or contact lens use. And so the symptoms are going to be similar to bacterial keratitis. And you can use antifungal medications to help treat these particular infections, but it can take them a while to heal, and occasionally surgery might be warranted. You can have a parasitic keratitis due to acanthamoeba, and the patient would be exposed through some sort of water source. It's a rare infection, but when it happens, it is a severe infection. And so we can see this a lot of times with contact lens use. using some sort of contaminated water source for those contact lenses, or swimming with contact lenses in and getting exposure through contaminated water source. And so symptoms of this, again, are similar to viral and bacterial. It is not contagious, but the diagnosis can depend on how severe the infection is and how the physician's going to actually diagnose that particular infection.